To understand Prop 34, you first have to get to know this man, Michael Weinstein. He was a prominent activist during the beginning of the HIV/AIDS crisis in the 80s and 90s. And over the decades, his AIDS Healthcare Foundation raised enormous sums of donations and secured large government contracts to treat and house people with the disease. Many say Prop 34, even though it's called a healthcare proposition, is really about him.
The way it's written, it is really targeting only one organization and one person. That's the AIDS Healthcare Foundation and its leader, Michael Weinstein.
Weinstein has spent tens of millions of dollars the past 6 years sponsoring props that would expand rent control in California. None successful. He believes housing is as essential as health care. But along the way, he's attracted powerful enemies, people who build, sell, and own rental units.
The corporate landlords who make profits off of high rents have put on an initiative, Prop 34, to basically stop AIDS Healthcare Foundation from putting any more initiatives on the ballot for renters and on behalf of renters.
Millions in cost relief for patients, millions in cost savings for taxpayers.
So what exactly would Prop 34 do? It would require groups like the AIDS Healthcare Foundation to spend money from government healthcare contracts on healthcare and not political campaigns.
Congress passed a law that allowed some nonprofits to sell prescription drugs at a discount and use that money to help patients and expand their patient care. Congress said that that's what that money should be used for.
Prop 34 supporters say it's about accountability, that government healthcare dollars should benefit patients and not be used for anything else. But does Prop 34 really target Weinstein? Take a look at the fine print. Prop 34 only applies to these groups if they also spend over $100 million in any 10-year period on anything other than direct patient care. And they also own and operate apartments, and they also have more than 500 high-severity health and safety violations. That exactly describes the AIDS Healthcare Foundation and no other group we know of in California.
Prop 34 was really put on the ballot by certain landlord and housing interests in order to try and combat Michael Weinstein, his support, and his attempts to increase rent control.
So, is Prop 34 really about protecting government-sponsored healthcare services? Supporters say yes. Or is it really designed to silence one man and his crusade for more rent control? Critics say yes. Prop 34, it's complicated, and in November, voters will have to decide. Lori Perez, KCAL News.